Hello and good day. My name is Dr. Uchenna Jones-Conley. I am a PGY3 family medicine resident at the University of Texas Health Science Center, Houston. Before I begin, I would like to thank my team of Dr. Nahid Rianan, Dr. Vijaya Malela, Dr. Jude Desbordes, and Michelle Klons. This presentation discusses the family physician's role in positively impacting maternal mortality and morbidity outcomes. Family physicians play a role outside of clinic visits in the health of families and communities and can screen patients in the postpartum period for social determinants that may raise risks for maternal mortality and morbidity. Our project background. The United States has one of the highest maternal mortality rates in the developed world. Maternal mortality and morbidity rates are unacceptably high in Texas as an extension. Women with low socioeconomic status are disproportionately affected. Effective management of postpartum care could help improve maternal health. As such, this project aimed to assess the need for a more comprehensive postpartum care process and assess access to care. Our problem statement. The project aims to improve the health and wellness of postpartum women and indirectly infant mortality. In 2016, Texas's Task Force on Maternal Mortality and Morbidity sounded an alarm regarding women in Texas are dying from childbirth-related conditions at an alarming rate. An 87% spike in deaths in Texas has occurred. As of 2015, the maternal mortality rate in Texas was 32.5 per 100,000 live births. The increase accounts for around 50 to 60 additional deaths per year. Texas ranks worst among most developed nations. The most common causes of pregnancy-related death in Texas, 42 days post-delivery, are cardiac events, drug overdose, complications from high blood pressure, homicide, and suicide. Our project objective. Our primary objective was to assess the need for a comprehensive postpartum template to screen and evaluate for maternal mortality and morbidity. Our specific objectives were: 1, to identify all postpartum women seen in the Aldine Health Center Clinic and Acres Home Clinic. 2, to determine if conditions that could lead to maternal mortality and morbidity were assessed during the postpartum visits. And 3, to determine how many women were transitioned to Texas Healthy Women Insurance. Our project methods. This project was conducted at an urban university-based family medicine clinic. A chart review of 21 pregnant women who were seen from July 2018 to July 2019 was assessed, and data on comorbid conditions and postpartum care was abstracted. Frameworks, models, concepts, and theories. These were derived from the community plan led by the Houston Endowment. Recommendation 1 is to improve the data collection and analysis on women's health to clarify understanding of the incidence of maternal mortality and to guide our efforts to reduce maternal mortality and severe morbidity. Recommendation 4 is to improve the general health of women by increasing access to primary health services in as many ways as possible. The community plan and these recommendations guided the direction of this project. The most common causes of pregnancy-related death in Texas post 42 days delivery to 1 year post-delivery are cardiac events, drug overdose, complications from high blood pressure, homicide, and suicide. The following lists the Texas Healthy Women Insurance criteria. Women who are eligible are women ages 15 to 44 who are a U.S. citizen or legal immigrant, a resident of Texas, not pregnant, not enrolled in health insurance, and earn less than 200% of the federal poverty level. Our preliminary results. Most women had at least one postpartum visit. 20% of our patient population did not. In most postpartum visits, the provider failed to address cardiovascular health, substance use, depression, and physical abuse with the patient. While most women in the sample should have been enrolled in Healthy Texas Women, a program that offers free women's health and family planning services to low-income women, none of our participants were enrolled. During postpartum visits, cardiac events were not addressed. Substance use addressed at 43.75% of visits. Depression was addressed 81.25% of visits. Physical abuse addressed 13.44% of visits, and hypertension complications addressed at 5% of visits. No study participants were enrolled in Texas Healthy Women, as mentioned earlier. The next phase. The needs assessment conducted in this project revealed women receiving postpartum care in a safety net system were not adequately screened for risk factors for maternal morbidity and mortality, nor not being enrolled in Healthy Texas Women's to continue healthcare coverage after 60 days post-delivery. As a result of the findings, a comprehensive postpartum care model should be developed to guide screening and evaluating of factors contributing to maternal mortality and morbidity. Also, an insurance enrollment transition process should be created to ensure continuity of care and eliminate loss to follow-up. Next phase continued. We are to develop and adopt a universal Harris Health System postpartum template to screen and assess maternal health concerns, specifically leading to maternal mortality and morbidity. 2, we are to create a process to identify and enroll postpartum mothers that meet the criteria into Texas Healthy Women after 60 days postpartum when their Medicaid expires. 3, we are to analyze a complete Harris County data set of postpartum women, including the high-risk population. And lastly, we are to determine if additional postpartum visits are necessary to better address the needs of the high-risk population, identify modifiable risk factors, and prevent maternal mortality and morbidity. Thank you for listening, and I hope you have enjoyed and learned from this presentation. Please see our references below.